Welcome back to the Back Pain Solutions podcast with me, Ben James, and as always, my co-host and good friend Jacob Stain. Afternoon, Jacob.
Afternoon, man.
So today we've got a bit of a listener question, which is very much focused on the squat and should I squat? Do I need to squat? And how will that affect my back health ultimately? And Jacob, I don't know about you, but this is definitely a question I get a lot. More so, of course, from people that are the gym goers and those people that exercise a lot. But I often get patients that will say, I can't squat, I won't squat again because of my back. Should I squat again for my back? I'd like to squat again for my back, but I'm not sure whether I should. So I think this is quite a good topic of conversation for today with respect to should I, shouldn't I? What are the good alternatives? Do those alternatives kind of supersede, or could they supersede the squat? Because we know this is a pretty common compound exercise when we look at deadlifts, bench press, squatting. It's one of those kind of fundamentals that a lot of people would incorporate or do as part of their gym routine. And certainly it's something that we do in terms of rehabilitation from the box squat point of view. So what are your thoughts in terms of the squat, in terms of back health, in terms of that being an aim or objective for people to do in the long term? And are there people that maybe they just shouldn't do it?
Um, First of all, I want to make it clear that we're going to talk about the actual squat exercise with generally putting weight on your back, because the squat
Yes.
the
Yeah.
squat pattern is something that's essential.
It's a great point.
Um, and we're not talking about the squat pattern. Just for those people who are wondering, we really want you to be able to make the squat movement with body weight, ideally, if your body allows it. But we're talking, like Ben says, about the the necessity for squatting with weight as part of a rehabilitation process. Is that needed? How important is that? But I have a similar experience as you, Ben. I People don't always ask me. They just, as I ask them, "What are you doing now?" Because you've been to see somebody else before you came to me, and part of their program was, at the physio or wherever, was to squat. So, and it didn't necessarily work, but they've been squatting as part of their rehabilitation process. And so my general view is it's very simple. It's, first of all, do you qualify to do the squat in terms of how far along your recovery process are you? Is it something that's gonna not make it worse, or is it something that's gonna make it better? And I think I mean, we can break it down into 1,000 parts. Um, it's very individual as well, but we want to we want to know how much it's actually going to contribute to you getting better, or is it so essential that it has to be part of? If we would say there's 5 exercises that you're going to do, does it have to be one of those 5, or do we start from a different place where we've got so much to work through in terms of a backlog with most of our patients when it comes to rehabilitative exercises, that we got to complete those first, work on a foundation, and then we get to a point where we've trained somebody to understand how to work with their core, how to bend through their hips. And then we get to that, let's load up the spine vertically and take or make a progression.
Yeah, yeah. And I guess let's strip it back a little bit more and say, well, let's say we've got an individual that's training that doesn't have any back pain. You know, is the squat fundamentally a good exercise to do? Are there better exercises to do? And is that an exercise people should avoid?
You say if a patient has, or
If
somebody has back pain,
if someone doesn't have back pain, the patient is
doesn't it?
well, no back pain. Maybe they've had a little bit of an ache over the years, but no incident. They're training regularly. They want to, let's say, they want to put on muscle mass or just general good fitness. Squatting is a pattern that can be beneficial when we're sitting, standing regularly. So it's an exercise that everyone could do. Is it an exercise everyone should do? if they're pain free, or are there better alternatives that actually, do you know what, don't bother because of potential risks with this exercise?
It's very individual, but it's definitely not an exercise you should do. Absolutely. There's so many variations, alternatives where we can set somebody up with a lower level of difficulty, where they can have very similar results or get strong in a similar way, work similar structures or parts of their bodies. Because the actual squat for somebody who's never trained how to squat or never had guidance in how to squat properly, because most of us will need proper guidance when it comes to learning how to do a proper squat. People won't have the understanding of how to squat if it's not something they've done and come from that sort of background. It's actually a very complex exercise. As simple as it looks, it's very complex. There's so many aspects to doing it correctly. There's a few variations. Um, Often, like if I talk about myself, my own experience with squatting, having done it from after school, maybe for now about, I say, 15 to 18 years, it's evolved. So my squat technique has evolved. It's something. It's a long process. It took me a long time to actually really dial in many aspects of my squat technique.
Yeah, and I think it's interesting you say it's evolved, because mine has had to evolve, and actually in the short term, recently, I've it's something I don't do, more so because of a knee injury, as as we've discussed at length. I've got an ACL and medial meniscus, and so that definitely gets aggravated by a squat in at the moment. But I've also noticed, as I've got a little bit older, that I find that I have to have a much wider stance from a hip point of view. Otherwise, I definitely get some discomfort through there. So I think this is something that's really interesting. That movement pattern is, like you say, quite complex, and needs to be done well and executed well. There are definitely individualities that dictate differences in that squat pattern and technique, and that could be with respect to hip mobility as a good example. And so, as well as you kind of progress through life, that technique may need to change depending on certain injuries or changes that you feel and experience. And I suppose, given that you said, there are so many other exercises that you could do that maybe will activate the muscles better and possibly safely, or more safely. Is it an exercise that you know we should just not bother with, given potential risks, complexity, and therefore it's only left to the elite that are weightlifters doing that particular movement, or because that exercise is particularly helpful for certain sporting endeavors, is there any point in it, I guess, is one question.
I I think there's a lot of people who are not squatting on that level that a professional or elite lifter is squatting, and I think that's fine. And I think again that's quite individual, very much body type dependent. What machine you're using? Is it a hack squat, which is very safe, or is it a Smith machine? And then we're going to a more complex or demanding exercise, which is just squatting with a barbell, where
Yeah.
you really need to control that movement from your ankle, knee, hip, back, what you do with your upper back, how you carry the bar on your back. So I think that there's a lot of overlap, and some people will be fine just doing it as part of their regular training routine, not going too heavy, um, not doing too many, not doing it too often, and that's going to benefit them. Doesn't mean that they have a very or a perfect movement pattern, and that's okay. As soon as we go heavier, or as soon as we go into performance, or as soon as we start speeding things up, like in CrossFit, you want to at least have a sufficient movement pattern that's going to carry you and make sure that you don't get injured. And then it becomes tricky in some cases where you know someone's body type is you're really tall, or you have long upper legs, or maybe you have stiff ankles, which means you can't really push that knee forward, or you're just not stable throughout. And then really that situation needs a lot of uh, probably a sort of a buildup of things and breakdown of specific parts of the body. So someone can get strong in those parts. Slowly, we start adding them together, and then we get a much better movement. And then we qualify that movement without weight, and then someone can build it up like what you're using a lot, say the box squat or so, and eventually get to a free barbell squat.
Okay, so before we summarize that bit of the discussion, what are the benefits of the squat for those who are doing it?
So, like anything that you do with your body, you're actually training this program of movement. And so the squat is like I said, it can be a very complex movement if you want to do it right. There's so many aspects of that movement if we break it down, and we want joint integrity. That's what we're going to get from doing a good squat. And so if we repeat that, we're just increasing this joint integrity, basically this program that we're just improving on the whole time. So the squat movement will come back when you have to push things, when you have to pick things up, when you have to move things. It's many of those movements are derivative of a squat movement, and a joint integrity starts in the foot, ankle, especially the hip. How to use your core. We're going to be able to brace in the core and not move through the back while we're moving through the hip, which sounds easy, but it's not actually that easy. So I guess joint integrity, and a second one would be bone density. So the stress you get on your bone, but as well that you get on your joints. This is very important because it just makes us strong over time, especially if you're a woman and you think of holding on to your bone density for later stages of your life. It's maybe even more essential, but I would say across the board, everybody can benefit from that.
Okay, so there's clear benefits from doing the squat in terms of loading and loading in terms of bone density, in terms of recruitment of muscles, of course, and in terms of joint stability. But there's clearly some things that really need to be considered with respect to the squat in terms of its complexity. So if you're doing it now, if you're pain free, if you've been doing it a long while, then there's clear benefits, and no doubt you've built that level of control and progressive loading that therefore shouldn't necessarily make that squat a risk to your back health. It's fair to say, if done if done correctly, of course. And so for those people that haven't experienced any back issues, haven't experienced any back problems, but potentially you've been at the gym a while, or you're considering going to the gym, and you're now considering to either incorporate a squat or start with a squat as part of your routine, the message there is, yeah, it can be really beneficial for you, but clearly get some input on that from a good instructor
Yeah.
before you just go ahead and start it yourself, just so you can be sure that you are making a bit of a considered approach to the squat, given the potential risks, of course, of injury, and that goes with many exercises, of course, but the squat particularly. So, on that basis,
Yeah.
for those that have experienced back pain, have some back pain, have some concerns, or really want to get back to the squat, I guess the next question, therefore, is we know that the squat can be really beneficial. Are there patients that potentially should never do the squat again?
Um, and you say never again. I guess then they've tried the squat. They've been there with a program, challenging their body with a squat pattern, and maybe it went wrong. So I would say in most cases, someone like that can return to doing a squat if we have identified what the problem is. And I have to say, unfortunately, quite often the guidance they've had is very poor.
Yeah.
So when I look at people's squat, I see 5 things that we can improve on. If they're small things, I would generally leave those for later. But the typical thing that we see is we see the back break. So we don't see that people are able to keep the low back still, the core stiff, and detach that from hip movement.
Yeah.
In other words, keep the core stiff, move through the hip instead of bending the back while you're moving through the hip.
Right. Yeah. Yeah. It's a common mistake.
Exactly. So, but then I would say on the other side, on the flip side, there's some people, when you reach a certain age, you don't have to be old, but even if you're middle aged, I'll have people here and I look at their body type, and maybe they've been very enthusiastic about starting to do weights and they want to do complex movements instead of just working with dumbbells, which are generally straightforward and not so complex. They want to do deadlifts and they want to do squats. And, I can see looking at their body type that it's going to take them a lot of effort to work to a good enough or qualifying technique where we're kind of sure that we can avoid injury. And then I'm very honest with them and I say, look, first of all, I wouldn't want you to squat too deep. I wouldn't want your thighs to be horizontal. I would like you to always stay above. And second of all, what's the goal? Are you going
Yeah.
to
Nice.
compete somewhere where you need to squat? Or, why would you have to squat? Why can't we turn it into a lunge, or a Bulgarian split squat or walking lunges or, by all means, maybe a box squat where it's very controlled, shorter movement. Um, those people are much better off not squatting. It's definitely some candidates for that category.
Okay. So let's say that you're listening, you've had back pain, you've kind of made some recovery and you're feeling pretty good. You're not suffering pain every day. You're pretty resilient in terms of your back health, but you're squatting and getting a bit of a reaction. There's potential there with what you're saying that there might just be some subtleties there with technique that actually, with the right advice and input, you'll be fine. Those individuals probably want checking in terms of their progressive loading and rehabilitation from that injury, in terms of core strength stabilization, good movement patterns, etc. But that forms part of that kind of coaching around a squat. So you might be listening and getting a bit of reaction to the squat and thinking you might not or should not do it, but maybe that's wrong. But potentially you just haven't got the right input. The flip side of that is there may be individuals that actually you are getting a reaction, or there are some potential factors that might warrant you just going with other exercises. Is that a fair summary? But of course, you need that relevant guidance and the relevant professional input to get that, which is of course challenging. So I guess there's always as you can reach out to, of course, but without the right input, if you're getting a reaction, the advice is probably just don't do it, particularly if there's a clear correlation between a bit of discomfort and having done a squat.
Yeah, I just want to make a clear distinction there again, Ben. That the you if you're say in your 40s and you go to the gym 3 times a week and you're happy with a squat where you don't go too deep, you don't go too heavy, chances are you're not going to mess anything up. But if you are younger or maybe also in your 40s, but you are out on a, you've got a goal and you've seen some stuff and you want to do something similar, complex movements where we go really deep, you want to start loading up on some weight and you have a goal where you want to get bigger and stronger, then you got to make sure that you're actually doing it in a very safe way.
Mm.
And the typical mistake I see is that people are just rushing.
Yeah.
They're way too quick to go too heavy. And, they, I don't hold it against anybody, but more than not, the technique is not good. So nobody's actually looked at the technique. They've just started building it up by themselves and they assume that it's okay. And it's very difficult. You're not seeing yourself. It's easy for me to say, hey, you need to change this and this and this because I'm standing over here, I'm watching you. If I'm doing a squat, I can't see what I'm doing wrong, even though I've seen a video of somebody doing it right.
Yeah, sure.
So there's definitely a lot of value in having somebody evaluating your squat technique. and try and take it up to begin slowly and slowly building it up, and make sure that it feels good before you start adding weight and speed.
Yeah, and I
Yeah,
would say that one factor definitely is, and that some of that would be with respect to cut corners or rush, etc. I think we've got to move away from this absolute need to squat deep. Is
yeah,
squatting really deep giving you any additional benefit than doing a really good squat well within certain limitations of movement? And I would argue it's not, not necessarily offering that much additional benefit. And clearly, there's going to be some sports and some things where it is, but I would say that is a very small minority.
yeah. You are better off squatting less deep, maintaining healthy tissue for that time that you have to squat deep at home to pick something off the floor,
Right.
than you are squatting deep on a regular base, irritating or damaging tissue, which is just going to cause more insult to and potentially even a worse situation.
Okay. And I think it goes without saying, if you suffered any back issues, there's got to be a certain percentage of time that is spent on that core training, that stiffness, neutral spine, understanding all these key variables we talked about historically before you introduce the squat. The squat shouldn't be the first thing if you've had a significant injury. I think that should be pretty clear, I would hope. But let's, Jacob, just in the time we've got left, maybe discuss some alternatives that could be considerations in terms of training and exercises that will target those muscles that a lot of people are doing the squat for: the glutes, the quads, hamstrings, etc.
So you said it. I mean, the main muscle groups we want to target is the glutes, the hamstrings, the quads, and the core. And so if we can break that down, and typically we want to do a squat more for glute posterior activation, even though it depends very much on the technique, length of the upper leg. Are we pushing the knees forward? Some people will squat a lot more, like weightlifters will use a lot more quad than anything else. But we have, in the general situation, we have a posterior chain glute and hamstring deficiency and a too much activated quad. So the general approach would be to activate more glute and hamstring. So glute bridges, single leg glute bridges, hip thrusters, if done properly, because it's with weight, um, lunges, great exercise. If you can maintain proper form, you're going to work a lot of glute, hamstring, but also quads, also core. You can do weighted lunges, normal split squat, even more controlled. So you're not walking, but you're in one place and just going down. You can do a supported split squat where you have your hand on the table, one foot in front, one foot in the back, and just touch your knee. And then you can really control where your front knee is going. So you can control the integrity of that movement. Um, and then ultimately, we talked about it. You can do box squats, which you're actually sitting, and because you're relaxed in the bottom position, you can find the right position, have your feet wide if that's going to help your hip mobility, and then from that position, tighten your core and stand up. So it's a very controlled squat, and it's also not as deep
Hmm.
because you're controlling the depth with the box. Um,
What
I
about
would say those are.
what about sled work?
Oh yeah, absolutely. I forgot about that one. Uh, Sled work is amazing and very safe because we're pushing through the spine,
Yes.
which means you have to position your body properly in order to push the sled. It's a very safe exercise, very much posterior chain. It's also single leg because you're pushing off
Yes.
with one leg at a time. So there's more need for stabilization. Um, Personal favorite of mine, Ben, as you know, I do it on a regular base. And yeah, sled push in this case, a
Hmm.
lot more posterior chain. But you can also do pulling a sled where you go backwards, which is very much quad
Hmm.
driven. Um, yeah, and then I think some other slightly more technical. I won't go too much into it, but is your single leg hip hinge. You know,
Yes.
um, yeah, just body weight, Romanian deadlifts,
So
things where you activate the
so I think
posterior
the
chain.
the 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 key is there's plenty of things. And we know that
Yeah.
the squat, there's no doubt a cohort of patients that gym goers, done it for a long time, absolutely determined to get back to the squat. And I think the message there is, look, there shouldn't be any reason not to. This is the message I will share with patients. Look, done well with the right rehabilitation plan, there's no reason why you shouldn't squat again. And I think that's a message to kind of take home and be reassured by. There's always a but, and that involves good rehabilitation and then outstanding form, particularly if you've had a significant back injury, of course. And so timing is important, and progressive load is clearly important, but there's no reason why you shouldn't. If you're pain free and you're just questioning whether you should or shouldn't do it because you've had someone that injured their back by doing a squat, or you're just concerned that could that be a risk? Well, again, if done well and if there's progressive loading, then it shouldn't be a risky exercise, because I often think that there is this kind of perception that the squat is a risky exercise for back health, and it really doesn't need to be that way. Again, if done within your own anatomical limitations, and those limitations may vary, but hip mobility could be a good one, particularly for those that are determined to squat deep. But there's no reason why you shouldn't do that. Uh, but if you're unsure, if you're concerned, if you get a little bit of reaction, or you just think, do you know what, I'm not going to do it again, then there's perfectly reasonable other exercise choices that will very well target the same muscles, give you very similar responses in terms of strength training or bulking, whatever your fitness goals may be. And so the squat is a fantastic exercise for the reasons outlined, but there are many other exercises that we can do. But I think the take home message is, shouldn't be any reason not to do it, whether you've had a back injury or not, but getting the right input is important. And you may just fall into that category, whether that's an age related thing, whether that's a recurrent injury thing that just means that, okay, collectively we make the decision that maybe let's just do these other exercises. But that doesn't mean that we can't revisit that further down the line. But good rehabilitation is so fundamentally important before doing that exercise, and getting the input on that exercise is important to avoid risk, whether you've had an injury or not. Because, like with anything, quality over quantity is important, and quality particularly is fundamentally important when we're training to mitigate against those risks. So I think an interesting conversation today, Jacob, and hopefully useful for the listeners. So we'll be back again with another episode soon. Thanks again for listening. Thanks, Jacob.
Thank you, Ben.